It's the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. It is Breast Cancer Awareness Month, and joining us in the studio, as she does every year for Breast Cancer Awareness Month, Dr. Nazneen Billimoria. Good morning.
Good morning, Todd. How are you?
Wonderful. Good to have you with us.
Thank you. Glad to be here. Can't believe it's been a year.
I know.
Already.
Wow. Jeez. It goes quickly. Our conversation brought to you by Marcus & Mack, voted Best Personal Injury Law Firm in the Best of Indiana County contest. Marcus & Mack, a law firm representing injured people. Well, you know, we might get caught up in the idea that, we said all this before and everybody knows it by now. But evidently not everybody knows it. And it's always good to have the reminder. Mammograms work, don't they?
Yes, they do, Todd. October is Breast Cancer Month. It happens to be my birthday month, so I got my mammogram last week, and I want to remind all you ladies out there, please go out and get your mammograms. The earlier we find breast cancer, the higher rate we have of curing it and treating it. And nowadays our imaging has become so advanced, as I'm sure Dr. Margaret Clark went through last week, that we are catching breast cancers at a very early stage.
Which changes the way that you as a surgeon approach breast cancer when someone is diagnosed. If somebody gets it early and they can spot it early, then that will change the way that you approach things.
Oh, absolutely, Todd. When we find a new breast cancer, and it's a small breast cancer, as we've mentioned before, we can do what is called breast conservation, where I am not removing all of the breast tissue, which is traditionally called a mastectomy, but I'm only removing a lump of tissue that contains the breast cancer. The remainder of the breast is preserved, and the cosmetic result, at least our goal, is to make it look like a woman never really had any surgery.
There are probably very few areas in medicine where the technology and the knowledge have, and therefore the techniques, have improved from year to year as it does with breast cancer. So what's the latest?
Well, the latest is... obviously the 3D mammograms came out a few years ago. Mm-hmm. We are also, the latest more so has been the immunotherapy that is being used for adjuvant treatment of breast cancer. You know, the thing with surgery and breast cancer is that the surgical treatments for breast cancer has not really changed. You know, way back when we started doing mastectomies, and then we introduced breast conservation where we did the lumpectomies with radiation. But the most recent advancements in breast cancer treatment has been with the changes and the advancements in chemotherapy, and then also the advancements in radiation. You know, previously when we did a lumpectomy, you had to follow it up with radiation to decrease the recurrence rates. Now, when we did radiation, we essentially radiated the entire breast. But now, depending on the patient's age, the type of cancer, how large it was, the radiation oncologists are only doing partial breast radiation, where they don't have to radiate the entire breast, but just the area where the cancer was located.
Yeah, that targeted is so...
Exactly.
Wow.
Yeah, exactly.
Wow. And you mentioned that with the imaging, IRMC now has 3D mammography at the Women's Imaging Center on the main campus,
yes,
at IRMC at Chestnut Ridge, and now Northern Cambria.
Yes. We do have breast imaging at Northern Cambria. Now, we so far only have, you can only get your screening mammograms over there. If you need additional studies like a diagnostic mammogram or ultrasound, you do have to come to Indiana. But the other thing is that I also go out to Northern Cambria now to see office patients. Mm-hmm. So any new patients who don't want to travel all the way to Indiana to see us in the office, they can come out to Northern Cambria, where I am, the first and third Wednesdays of every month in the mornings. Now, unfortunately, we would have to do surgery at Indiana, but all of your office care and follow-up care can be done at Northern Cambria.
Yeah, that's wonderful. That really is. All right, so tell me about screening mammography versus diagnostic.
Okay, so a screening mammography is basically the imaging that women get when they are just going in for a routine screening. So this is women who have not, have no palpable findings in the breast, no abnormalities. Everything is as it was before, so they're just going in for their screening. Now, if there is something abnormal picked up on the screening mammogram, then they are called back for additional imaging, and that would maybe include a diagnostic mammogram and possibly an ultrasound. A diagnostic mammogram is essentially similar to a screening, except it takes a closer look at the area where the abnormality was found. So potentially more compression of the breast tissue in that area to see what is truly there. And then that is also accompanied with an ultrasound at the same time to see if there is truly a mass or an abnormality there. Is the mass a simple cyst, which is completely benign, or is it a true mass that could be something that's cancer?
Then comes the biopsy.
Exactly. And then after that, depending on what the diagnostic mammogram and ultrasound show, if it is something suspicious, then the radiologist is going to recommend a biopsy. Mm-hmm. In which case, then women come back for their biopsies, and then we take it from there.
All right. So, and you as a surgeon, you would be the one performing the biopsy? Or?
No, actually, it is the radiologist. So most of our breast biopsies are done by Dr. Margaret Clark, who was on last week. And she is fantastic at what she does. I mean, I think apart from my husband, she is probably the person I speak to most, just because we are constantly talking about patients' imaging and what we need to do, and whether they need surgery, whether they need another biopsy. So typically that biopsy is a needle biopsy. It's done under local anesthesia, and it's done by the radiologist. Yeah. And that is typically the standard of care at this time.
Yeah, and that really emphasizes that it is a team approach at IRMC.
Oh, absolutely it is. And it's not just Dr. Margaret Clark and myself. It's also my other colleague, my other surgeon colleague, Dr. Dan Clark, who will be on in a couple of weeks. And then, of course, our radiation oncologist, Dr. Chitty, who is part of UPMC, but we have that affiliation. And then, of course, Doctors Ramanini and Kamanova, who are our fabulous medical oncologists who we've been working with for the last several years.
That's quite the group that you have.
Yes, we do. We do.
And the Mammoglam event that's coming up on October 23rd is a chance for people to meet the entire team.
Yes, it is. And they're going to be giving away other, prizes and things like that. And it's on October 23rd. I will be there as well to speak to patients or anyone coming who have any questions. So I hope it's a successful event. So it's on October 23rd from 4 to 6 at the Women's Imaging Center.
Yeah, and if folks want to get in on it, you can RSVP by calling 724-357-7188. And, of course, Mammo Mondays at the Women's Imaging Center.
Yes. Yeah, if you don't want to make an appointment and you just need to get your screening mammogram done, come on in on Mondays to our imaging center. It is walk-in hours pretty much all day, and you can get it done then.
When a woman is diagnosed with breast cancer, that diagnosis can be devastating. It can knock her down. And it takes a little bit of time to process all of that information. I think IRMC does a really, really good job of helping her through that early process to take her from stage to stage in the treatment.
Yes, I think we do an excellent job with that. When a woman is first diagnosed, usually the diagnosis is given by the radiologist. And then as soon as she gets that diagnosis, she is in contact with our nurse navigator, who's Dina Deal. And Dina kind of starts walking women through what the next steps are. For example, she gets them their appointments with either myself or Dr. Dan Clark for the surgical part of treatment. And then she also gets them their appointments for medical oncology, which would be down the road. I think she does a wonderful job with that. And it's just one less thing that patients have to think about, like, oh my gosh, where do I go next? Who do I have to call? What office do I go to? Mm-hmm. So that's all taken care of for them.
One of the more frightening aspects, I'm sure, for a woman upon hearing that diagnosis is the prospect of surgery, which is what you do. And so you've gotten some women probably in a very highly emotional state who you have to reassure. And that's a tricky process, isn't it?
It is a tricky process, and I'll tell all women out there that's why we're saying get in there and get your screening mammograms, because the earlier we find this and the earlier stage your breast cancer is, the higher rate you have of a cure. Essentially now, stage 1 breast cancer, we essentially cure women of that. So when women do come in with more advanced stages of breast cancer, sure, they are more scared. They are, they are more apprehensive about what's going to happen. And that is a, it's a tricky balance between, being honest with them and, what they need to expect, and then, what their overall outcome is going to be.
Help me with this term, because I just heard it for the first time yesterday, and I heard it secondhand, and I've never heard this term before. But we think of cancer in stages: stage 1, stage 2, stage 3, stage 4.
Yes.
I heard the term nuclear yesterday. Have you ever heard that term before?
Nuclear, as in, you mean like the
tumor itself?
The nuclear grade, it's referring to the aggressiveness of the cancer. The nuclear grade, so there's grade, grade 1, 2, 3, and that tells us how aggressive the actual cancer is. So grade 1 would be a more of a well-differentiated, a less aggressive cancer. Grade 2 would be somewhere in the middle. Grade 3 would be more of an aggressive cancer. So that speaks to how likely it is the cancer is to spread to other places and things like that. So someone with potentially a grade 3 cancer is going to be more likely to require possibly chemotherapy than someone who has a grade 1 cancer.
So a breast cancer, like many other cancers, it can have all kinds of different characteristics to it.
Absolutely.
And therefore different levels of aggression.
Yes, absolutely it can.
Yeah.
So, just because, there are women who have stage 1 breast cancers who still require chemotherapy. And that's, and that it definitely depends on the characteristics of their tumor. The most commonly heard characteristics are the hormone receptors, is whether the estrogen and progesterone receptors are present on the breast cancer. And then there's a third receptor called the HER2 receptor that we test for every time we diagnose a breast cancer. So most commonly, women will have a hormone-positive, HER2-negative breast cancer. And those breast cancers, if they are early stage 1, grade 1 breast cancers, they are most likely going to be treated with surgery, radiation, and then eventually anti-hormone medication that the oncologist puts patients on to decrease their risk of a recurrence. Now, other patterns are a triple negative breast cancer, where it's hormone negative and HER2 negative, and those women are more likely to require chemotherapy. So
I have put you through your paces here this morning.
Yes, you have, Todd. So there's a wide range of breast cancers and grades, and they all require different forms of treatment.
Yeah. And thankfully, we have a really, really good team, the Comprehensive Breast Center at IRMC. They help us to figure it all out. Dr. Nazneen Billimoria, I'm out of time, and I have probably 1,000 more questions for you. But if folks want to get answers to those questions, Mammoglam on October 23rd would be a good place to get them, because the whole team's going to be there.
Yes.
Thanks so much for coming in today. Appreciate it.
Thank you, Todd.
It is the voice of Indiana County. It's WCCS 101.1 FM, AM 1160, and WCCSradio.com. And Jake in the newsroom, he's coming up.
This is Boomer Esiason with the CBS Sports Minute, sponsored by PAsDoThat.net, where you can learn about board-certified PAs who treat over 10 million patients every week. Today's birthday shout-out goes